Here's a question that is on the floor. Should Narcan become more accessible in local schools? It's a question the mayor of Apex is raising attention to on the heels of a House Select Committee he's been invited to speak at this week. In 2023, an average of nearly 12 people died each day in North Carolina from overdoses. Let that sink in. North Carolina's, or WRAL's Lora Lavigne, shares the latest push to save lives.
February 14, 2016 is the day that changed Frida Knott McDonald's life forever.
When I got the toxicology report that he died from fentanyl, I didn't even know what fentanyl was at the time, other than it was something that was used in the hospital setting.
Her son Michael was 24 years old, trying to turn his life around.
And he was in recovery, but there was not a situation where Narcan could be used for him, and so he did pass away.
From 2016 to 2024, a lot has changed, and a lot hasn't. A big difference now is the drug Narcan has become available on store shelves, even vending machines. But what about schools?
This is a crisis. This is a public health and safety crisis, and we have to take it seriously.
Mayor of Apex, Jock Gilbert, has pushed for more to be done on a local level as substance abuse, opioid, and fentanyl deaths are on the rise. His experience, not only as mayor, but previously as a school resource officer, brings a different perspective.
We got a lot of products that has THC, and then when you add fentanyl to it, and they may not even know that fentanyl is involved or a part of that product, it creates a significant risk for our community. It's a public health and safety risk. So for me as an SRO, I did unfortunately have to work with parents that had those tragic deaths associated with those type of things, and it's getting worse.
85 of North Carolina's 115 school systems have Narcan on some campuses. In the 2020-2021 school year, the most recent one we have data for, Narcan was used 14 times for suspected overdoses.
Does it worry you that Apex and a lot of schools here more in the Triangle aren't a part of that number?
Absolutely. I mean, we are like the largest county in North Carolina. And we want to have our youth to be successful here. And we want to put life-saving resources in the hands of our teachers and other staff to make sure that if there is a medical emergency, we can react to it.
He says there is some opposition regarding fear, the stigma of it all, and funds to train school staff to use it.
For the fear of, okay, if we have this, will that make people feel more comfortable with using because we can bring them back? We need to ignore those kinds of thoughts, because what we need to think about is how to save a life.
Approaching the 8th anniversary of Michael's death, McDonald now leads her own nonprofit, No Hope NC. She believes Narcan is a solution that should not be turned away.
But if it is there and we can have the opportunity to save a life and to be there for a person, then that is something I believe everyone can live with.
Lora Lavigne, WRAL News.
She's sounding the alarm. Now, Apex has a substance misuse task force to provide education resources and hope for those affected by substance misuse. Mayor Gilbert asked for input on this topic from the community and will share thoughts at the House Select Committee on Substance Abuse Wednesday morning. We will follow up.